blue line is at the top because the 3 needles are slightly scooped, almost like a fork or a spoon. And then you stretch the skin. Always start on the neck first. It's the easiest place to learn how to do it. Everybody struggles the first 3 times to use it. Then you push it in at a 45-degree angle, blue line at the top. You lift it up a little bit, and then you start pushing to make a papule. And then on the neck and on the eyes, the easiest way to get started with it. When training doctors, you'll notice there's a few mistakes that they'll make. And what I've noticed is that a lot of doctors would push it in and then they just push further and they're not injecting, which is incorrect. You must push it in, lift it up, and then inject. The other mistake that some of the doctors do is they start injecting and then there's too much fluid on the skin and then it's too slippery to get it in. So they must first put the needle in and then only inject. So this is a common mistake, is pushing on the plunger too quickly. And the other thing is they go in, they've got it perfectly positioned, but they're not pushing enough on the plunger, and then they think it's incorrect because they don't see a papule forming. So it's really just to get the feeling of it, because it's different than a different injection, that it has to be the blue line at the top, because if it's slightly angled, the needles are curved this way, it doesn't go in. If it's down, the needles are curved this way, it also doesn't go in. So just make sure that you pull the skin, start on the neck initially, and then lift up and make the papules. As soon as you get it on the neck, and you've done a few patients, then you'll see you can do the full face treatment. Then you can even do on the cheeks, which they usually say it's not possible. You don't see such perfect papules forming, but it's still forming. But just first get the hang of it on the neck and around the eyes, and then as soon as you've got the hang of it, then you just do the whole face. You can even use it a little bit for epidermal technique, where you do this type of a technique, especially if you really feel that you've got too much product left. You'll find some of the doctors prefer it on a 1 ml syringe because it's easier to push, but the 3 ml syringe is really not difficult. It's quite heavy on the thumb. Your thumb muscles, if you've got too many patients for the day, it gets quite painful. But otherwise, just carry on. Just make sure blue line is at the top. Push it in 45-degree angles, lift up the skin, and inject until you see the papule. And the papules are quite nice. They go away within 10 to 30 minutes. If you make 2 big papules, it can sometimes last for like 3, 4, 5 hours. So initially to practice, you can make big papules, but it's actually better to make smaller ones because they go quicker away for the patient and they don't have any signs of having the treatment. Okay, I hope this helps.